MDMA, is it a psychedelic or is it a stimulant? A new study has shown that MDMA actually affects our brain connectivity more like an amphetamine than a psychedelic. Scientists looked at the brain scans of people on LSD, MDMA, and d-amphetamine, which is an ADHD medication. Here are 3 things we learned from this cool new study. The first one is that psychedelics are unique in their ability to interrupt communication within the default mode network. This is a network that's related to our sense of self and introspective thinking. Disruption of this network is directly related to subjective feelings of unity or oceanic boundness reported by people on LSD. Number 2, MDMA changes your brain connectivity just like an amphetamine. There's nearly identical patterns of activity in the auditory sensory motor network when participants took d-amphetamine as when they took MDMA. This is a brain network that processes sensations and sounds. Very similar activity was also seen in the salience network, which helps us decide which internal or external stimuli need to be attended to. This might suggest that we process and prioritize sensory information in a very similar way on these drugs. And number 3, LSD has a greater effect on the brain's gatekeeping system than MDMA or d-amphetamine. There's more connectivity between the basal ganglia and the thalamus. According to the thalamic filter model, the thalamus basically works to filter out sensory information that needs to be processed by the cortex. Psychedelics allow more sensory information to be passed through this filter and perceived by us, which is linked to the sensory and visual experience of psychedelics. Although there's some overlapping neurobiological systems between MDMA and psychedelics, it seems in terms of brain connectivity, MDMA has more in common with a stimulant like d-amphetamine than it does with the classical psychedelic, which makes sense when you remember the full name of MDMA.